Whether you're exploring your local neighborhood or embarking on a global adventure, if you live with chronic obstructive pulmonary disease or COPD, you know the importance of taking extra precautions during your travels. Thankfully, COPD doesn't have to hinder your ability to travel and explore the world. Let's talk about some of the precautions you can take to establish worry-free routines for travel. First, let's talk about the supplies you'll need when traveling. Here's a great starting checklist that you can use and add on to as needed. Always be sure to pack your oxygen concentrator, any medications you may be taking, a nebulizer for any inhalant medications, at least 2 nasal cannulas, fully charged spare batteries and charging cables, pulse oximeter to track your blood oxygen saturation, hand sanitizer, and any other backup supplies such as extra tank regulators and keys, extra tubing, cannulas, connectors, or batteries. Next, here are 5 helpful tips to keep in mind no matter where you go. Changes in weather can greatly affect COPD, so be mindful of the forecast and air quality at your destination. If it's going to be cold, take warm clothing, including a scarf so you can cover your nose and mouth to keep the air you breathe warm. If it's hot outside, be sure to wear light clothing and bring extra water to stay hydrated. If the air quality is bad, you might want to plan indoor activities or pack surgical masks to protect your lungs. Bring hand sanitizer. Whether you're putting gas in your car or just making your way through the airport, germs can be found on surfaces everywhere. Using hand sanitizer frequently is a great way to avoid getting sick while traveling. Stay up to date on vaccinations. Especially if you're traveling overseas, let your doctor know so they can get your vaccines or flu shots up to date before your trip. Request smoke-free environments. When booking your hotel, be sure to request a non-smoking room to avoid breathing in smoke particulates during your stay. Take someone with you. This makes it easier to get the help you need in case of an emergency. If you can't arrange for a travel companion, make sure at least 1 or 2 people you know have the full itinerary of your trip. Keep their information handy as your emergency contacts and make sure they have access to your medical information so that they can help you if needed. Lastly, let's talk about some guidelines for long-distance travel with COPD. First, it's a good idea to call your airline, hotel, or cruise line to request information about accommodations or requirements for your medical equipment. Many airlines have a list of pre-approved oxygen concentrators to help make meeting their requirements easier. Next, make sure you have enough oxygen and power for long-distance travel. If you use a portable oxygen concentrator and don't have enough battery power for a long flight, ask the airline if they can supply power for your concentrator during the flight. Airlines in the US require battery life of 1.5 times the flight duration. Consider the altitude. If your destination is at a high altitude, like in the mountains, you might need to take it easy on the first day or 2 to get used to the new height. Carry medical documentation. Some travel authorities might require a note from your doctor clearing you for travel. It's also a good idea to carry copies of your prescriptions. And ask your insurance provider if you have coverage at your destination. Arrive early. Delays are usually inevitable while traveling, especially when medical equipment is involved. By arriving early to your flight or cruise line, you can help make the process smoother and less stressful. Finally, get familiar with the medical care available at your destination. What hospitals or clinics are there in case you need to use their services? Traveling with COPD is not only possible, it can be stress-free and enjoyable with a little bit of preparation. If you have any questions about traveling with COPD or you're looking for a portable oxygen concentrator, please contact us. When you breathe easier, we breathe easier.